Last week, a 63-year-old patient told me something I hear constantly. He and his wife have sex maybe twice a month. And afterward, he always has a beer or two to relax. 3 months ago, he started noticing his prostate symptoms getting worse. Weak stream, getting up twice at night, difficulty emptying his bladder completely. He thought it was just age. But when we ran tests, his prostate inflammation markers were elevated. And the timing was suspicious. I asked him a direct question. Do you drink alcohol after sex? He said yes, almost every time. Just 1 or 2 beers to wind down. I told him, stop doing that for 30 days. Let's see what happens. 6 weeks later, he came back. His nighttime trips dropped from twice to once. His stream was noticeably stronger. And his inflammation markers had decreased by 40%. All he did was stop drinking alcohol after sex. I'm Dr. Elena Martinez, a urologist, and today I'm going to explain exactly why alcohol after sex damages your prostate. After 60, what's happening in your body, and what to do instead. By the end, you'll understand a simple change that can protect your prostate long-term. Quick question. Before we start, where are you watching from? Drop your location in the comments. And if this is useful, subscribe. I share practical men's health content every week. Let's talk about what alcohol does to your prostate immediately after sex. When you ejaculate, your prostate contracts forcefully to expel fluid. This is normal. But after ejaculation, the gland needs to recover. It's slightly inflamed, blood flow is elevated, and the tissue is temporarily more sensitive. If you drink alcohol within 1 to 2 hours after sex, here's what happens. First, alcohol is a diuretic. It makes you urinate more, but it also dehydrates your body rapidly. When you're dehydrated, your urine becomes concentrated. Concentrated urine irritates the bladder and prostate. This irritation compounds the post-ejaculation inflammation. Second, alcohol dilates blood vessels. Normally, vasodilation isn't bad, but in an already inflamed prostate, increased blood flow causes more swelling. The gland expands. This puts pressure on your urethra, making urination weaker and more difficult. Third, alcohol suppresses your immune system temporarily. After sex, your prostate is in a recovery state. Your immune cells are cleaning up microscopic tissue stress. When alcohol suppresses those cells, recovery slows. Inflammation lingers longer than it should. The combination of dehydration, increased swelling, and slowed recovery creates a perfect storm. Your prostate stays inflamed longer. Over time, chronic inflammation leads to permanent enlargement. One patient described it perfectly. He said it's like twisting your ankle and then going for a run immediately after. You're compounding the damage. Now here's what most men don't realize. The damage isn't immediate. You won't feel worse the next day, but after 6 months of drinking after sex regularly, symptoms start appearing. Weak stream, nighttime urination, difficulty starting, incomplete emptying. By the time you notice, the pattern has been established for months. So what should you do instead? Step 1. Wait at least 2 hours after sex before drinking alcohol. This gives your prostate time to recover from the ejaculation cycle. Inflammation starts decreasing, blood flow normalizes, your body rehydrates naturally. If you must have a drink the same night, make it at least 2 hours later, not immediately after. Step 2. Hydrate with water first. After sex, drink 8 to 12 ounces of water. This flushes your system, dilutes your urine, and reduces irritation. Then if you want alcohol later, you've already protected your prostate. Step 3. If you're already experiencing prostate symptoms, eliminate alcohol after sex completely for 30 days. Track your symptoms, nighttime trips, stream strength. How you feel? Most men notice improvement within 3 to 4 weeks. Some see changes in 2 weeks. Now, many men ask me, what about the inflammation that's already there? What about chronic enlargement? This is where targeted support becomes important. Alcohol avoidance prevents further damage. But if your prostate is already inflamed or enlarged, you need compounds that actively reduce swelling and support tissue health. The combination that shows the most consistent results in clinical studies includes saw palmetto, pumpkin seed extract, pygum, zinc, and beta-sitosterol. These work together to reduce DHT, decrease inflammation, and improve urinary flow. Saw palmetto blocks the enzyme that converts testosterone to DHT. DHT is the hormone that makes your prostate grow. Pumpkin seed extract contains compounds that relax bladder muscles and improve emptying. Pygum reduces inflammation directly. Zinc supports prostate cell function, and beta-sitosterol improves urinary flow by reducing swelling. These need to be in clinical doses. Most supplements have tiny amounts that don't match research doses. You need saw palmetto at 320 milligrams, pumpkin seed extract at 1,000 milligrams, pygum at 100 milligrams, zinc at 30 milligrams, beta-sitosterol in effective concentrations. I've left a link in the description to a formula that contains all 5 in the doses shown effective in studies. Many of my patients use it alongside lifestyle changes like avoiding alcohol after sex. Most men report noticing improvement in urinary symptoms within 3 to 4 weeks. Better flow, fewer nighttime trips, easier emptying. The link is right below this video. You can see the full ingredient breakdown and doses on the product page. Here's your action plan. Step 1. Stop drinking alcohol immediately after sex. Wait at least 2 hours, preferably longer. Step 2. Hydrate with water after sex, 8 to 12 ounces. This protects your prostate during recovery. Step 3. If you already have symptoms, eliminate post-sex alcohol completely for 30 days. Track your improvement. Step 4. Consider targeted prostate support with the 5 key compounds in clinical doses. The link is in the description. Step 5. If symptoms persist after 30 days, see a urologist. Some conditions need medical evaluation. Prostate health after 60 isn't about avoiding everything. It's about timing and supporting your body's natural recovery. Small changes, like when you drink alcohol, can make a significant difference over months and years. I'm Dr. Elena Martinez. Thanks for watching. If this was helpful, like and subscribe. Drop a comment if you have questions. And if you're dealing with prostate symptoms right now, check that link in the description. Many men report real improvement with the right support. Take care of yourself.